How does an HIV prevention pill work and how effective is it?
So the pre-exposure pill, as you refer, is actually an antiretroviral agent. So we know that it is able to kill and stop replication of the HIV virus. So the agent that we use for PrEP is actually a combination of two well-known antiretrovirals. One is called tenofovir, the other one is known as emtricitabine, and they have been combined into a single pill. And that pill, tenofovir plus emtricitabine, is able to stop the replication of HIV in the tissues. So it does mean if we're going to use it as prevention, that we have sufficient of that drug in our tissues at the place where HIV might make contact. So that's where, as you allude, we have to take it ahead of time, and we have to take it sufficiently well that we get our tissue level up in terms of having the actual ingredients at the site should we encounter HIV and it comes into our bodies. It will meet that antiretroviral, which will actually stop it and block it and stop the infection taking hold. So we think it works at that point. Probably, if you acquire your HIV sexually, probably at the lymph nodes of the sexual reproductive tract, and stop the HIV replicating. So it's important that we have sufficient of those two antiretrovirals in the tissues, and that means we have to take it regularly, as you were saying.
Dr. Pillay, if I would like to use an HIV prevention pill, where would I find that in South Africa and how much will it cost me?
In the public sector, since 2016, we have expanded access to pre-exposure prophylaxis oral medication to over 1,900, that's 1,900 public clinics and community health centers. So more than half of all public clinics and community health centers in the country currently offer oral PrEP. And, for the public sector, as you know, for primary healthcare, people don't pay a single cent for any treatment, and that includes HIV treatment, and it includes pre-exposure prophylaxis against HIV acquisition. So it doesn't cost people who use the public sector any money at all. It's completely free. And of course, we would therefore like to encourage people to take up this opportunity to use PrEP if they are involved in sexual activity that might be risky. And that is, in fact, not using condoms, either male or female condoms, having multiple partners, and generally not taking good care of their sexual health.
Professor Bekker, does it have any side effects when you use an HIV prevention pill, and how often do you need to use it? Is it every day?
So these are well-known antiretrovirals. In fact, they're the cornerstone of our treatment. So many, many millions of people have actually taken or are taking these two antiretroviral agents in combination for their treatment or as pre-exposure prophylaxis. All antiretrovirals do often cause a little bit of what I call ickiness. When you just start, you feel a little bit out of sorts. And that's really the body adjusting to the antiretroviral agents. And so individuals may feel a little bit of fatigue. They might feel a little bit of nausea, a bit of bloating. But in the vast majority of people, those side effects disappear within a few days to weeks, gone in a month. So we estimate sort of 1 in 10 might have those very early nondescript symptoms on starting antivirals. Really, they are very easy to take indeed. The one agent in particular is removed from the body via the kidneys. So your practitioner, the person who orders this for you, may do a kidney check to begin with. And if there are problems with the kidney, you may be advised either to take a close cousin antiviral, which is more forgiving, or you may just be given some other kinds of instructions to stop for a bit and then restart. But by and large, These are very easy drugs to take. The usual healthy individual who's going about their daily lives, who isn't unwell, would be able to take these treatments very well indeed. There really is very few side effects to worry about. There is some monitoring that will be done in parallel with taking them, but even that is very minimal. It's important that you are not acutely or recently infected with HIV when you start. So somebody who knows what they're doing should check you to make sure you are in fact not HIV infected. That is very important. If there's any concern about that, your practitioner will give you advice as to how to be sure that you are not in a risky period of having recent HIV infection.
There is a 2-monthly injection that you can take to prevent yourself from getting HIV. Does it work in the same way as an HIV prevention pill?
It does, Mia. You have to, in this case, get an injection into your bottom every 2 months. But the same principle is it is an antiretroviral, again, a well-known antiviral, which is then absorbed into the body and then can block HIV in exactly the same way. The wonderful thing here is not having to take a daily pill.
Dr. Pillay, this injection exists, but it's not available in South Africa yet. Why is that?
The first thing is that it's not registered by SAHPRA, the body that registers these medicines in South Africa. So what needs to happen is that the manufacturer, in this instance, a company called ViiV, has to send a dossier like any other medicine to SAHPRA, and SAHPRA will then review it, consider its safety and efficacy, and register it if it considers it safe. And the second part of it, once it's registered, of course, it needs to be purchased by the Department of Health. And one of the key issues that the department will, of course, consider would be the advantages of this injectable relative to the current gold standard, which is the oral PrEP with those 2 ingredients in them. The oral preparation costs 60 Rand per person per month. So for the country to afford providing the injectable free of charge in the public sector, we need to get the injectable form as close as possible to the 60 Rand per person per month. So there are 2 things that needs to happen. Firstly, it needs to be registered by SAHPRA. As secondly, it needs to be affordable. We certainly hope that this can be done because there are many advantages for many people, not everyone, but for many people, having an injectable would be more convenient. So we would like to make it available. It should be available hopefully sometime next year.